To express my gratitude and my honor to be here in this with my eminent professors and colleagues in this successful conference. هما 10 minutes إن شاء الله، مش هطول عليكم. هي الستادي كبيرة ولكن هحاول أختصرها. أنا بتكلم على psychiatric morbidity in wives of substance users. It was an Egyptian sample. لما بنيجي نتكلم على الادكشن بنتكلم اكتر على البيولوجيكال تريتمنت السايكوثيرابي، لكن بننسى ان life is lived in relationships and the quality of those relationships has much to do with how life turns out. Expected that the spouse of an addict or a substance user are experiencing burden related to the illness of their husbands, and consequently the duration of the marriage and the illness will increase the burden. This is a case control study. فيها 120 addicts wives and 120 control. The sample were collected from the outpatient clinic of the Institute of Psychiatry and Shams University. Our inclusion criteria that they were married, the duration of marriage at least 2 years, and duration of substance use during the marriage is for the past 2 years. The following were excluded: those wives who are already diagnosed as psychiatric patients before marriage, any history of psychiatric disorder or psychiatric treatment in those wives, patients with the dual diagnosis, duration of marriage less than 2 years, divorce or separated couples. An oral informed consent was taken from the patient and his wife. Screening test for the wife, it was in the form of the general health questionnaire, assessing the social class using the Egyptian classification of Fahmy and El-Cherbini. Then we turned to the diagnostic test for those wives who were found to have psychiatric morbidity, using the structured clinical interview for DSM-4 access to disorder, SCID-2, mini international neuropsychiatric interview, the mini plus the Arabic version, and the North Carolina family assessment scale and the social readjustment rating questionnaire. The age group was around 36 years old. The subdivision of addicts they were the 24% drivers, 17% were unemployed. The most common type of substance used was the opioids. And the social rating adjustment questionnaire have finding that 80% of our sample have the chance of illness. The common stressful life events found in the current study was the marital problems followed by the sexual difficulties. And the sexual difficulties were found 37 times more in the addict group than the control one. SCID-2 resulting that the most common type of personality disorder found on those wives was the borderline personality disorder. And it was accepted and expected. The mini plus, which revealed the psychiatric morbidity, revealed that the adjustment disorder followed by the major depressive disorder were the commonest psychiatric morbidity among those wives. In comparison to the control group, we didn't find many psychiatric disorders. The adjustment disorder as a diagnosis in the wives of addicts were found to be more prevalent in those wives married for 2 years. It was prevalent also in wives of those husbands who were seeking help in the outpatient clinic after relapse. Consequently, those wives married for more than 5 years suffered from the other disorders such as panic attacks or social phobia. The major depressive disorder were found more in those with longer duration of marriage. These findings were accepted and expected. Living in such an environment may have a direct pathogenic role on the vulnerable individuals in the developing disorder. When we studied the relation between the husband's type of drug and the psychiatric morbidity in their wives, we found that the psychiatric morbidity was more among the wives of opioid addicts. And the comorbidity were found more on those wives diagnosed with the borderline personality disorder. It was found that the histrionic personality disorder have the higher rate of suicidality, whether suicidal thoughts or even suicidal attempts. The North Carolina Family Assessment Scale is covering a lot of area in the life of those addicts and their families. In the overall environment, there were a discrepancy between our group of addicts and the control group. They have problems in the financial management and the employment and the income. Also, they have difficulties in their parental capabilities. They cannot provide their children any enrichment opportunities or a good supervision. This is also a difference between the addict wives and the control group as regard the family safety. There is a high incidence in domestic violence between the parents. Domestic violence, many studies establish a link between the substance abuse and women abuse, but not a direct link. Substance abuse increases the risk that men will batter their partners, although the substance per se is not the key factor. Studies suggest that the other factors link men's substance to violence against their partners. There is a relation between the type of substance and domestic violence, and it's more with the opioid users. It was found that the middle social class have the higher incidence of domestic violence, more than the low social class or the high social class. It was important to find if the spouse were taking or sharing their husband's the drug intake, and it was found that the borderline personality disorder followed by the histrionic personality disorders may take even once with their husbands. We concluded that historically, the studies suggested that the wives of drug abusers have been described as having disturbed pathological personalities, and these personalities may maintain their husband's abuse, and this is against the women, by the way. The behaviors of these women reflect their stressful circumstances. They reported interpersonal and intrapersonal stressors. To conclude, we found that there is a high incidence in adjustment disorder, major depressive disorder, and anxiety disorder, and these findings were accepted and expected. So what are we going to do? We have to involve the addicts' wives in the plan of management of their husbands, to interfere with the psychiatric morbidity if present, to improve the outcome, and to teach them about the nature of the substance abuse disorder and how to deal with it. We have a clinical recommendation, careful assessment of addicts and their wives to identify the psychiatric morbidity if present, the use of specific tools to assess personality traits in the substance users and their wives as well, and to be taken considerably in the plan of management, especially the presence of certain traits that may have impact on the outcome and predict the possibility of relapse. Our plan of management is not only the psychotherapy, it's a tailored plan of management for each addict, and their wives and their families should be taken. We should put in consideration their children. We put how to prevent the effect of this. We have a biological vulnerability for those children, so we have to act psychotherapeutic to avoid the presence of substance use in them also. Research recommendations. More research is required to focus on the spousal system and its role in the substance use disorder. Qualitative research methods eliminate all aspects regarding the context of spouse burden and participating in management. More longitudinal research on the children of substance users to predict early disorders and behavioral deviations. Thank you.